Today, we will be giving you training on essential caregiving. With the advent of COVID-19 in February 2020, we have had lockdowns, partial openings, indoor and outdoor. Well, we have not had indoor visitation, but outdoor visitation. In October 2020, the Department of Health and Human Services has phased us to what we call an essential caregiving program that will allow essential caregivers, whether physical or emotional caregivers or psychological caregivers, to walk into the facility to render care. We want to be able to do that safely for all our residents and for our staff and for the caregivers themselves. So we hope that this training will help prepare you for this essential role. At the end of the training, there will be a self-inventory question that you will need to answer and a statement of understanding of your role and responsibility as an essential caregiver. Please remember that this training is intended for use in this facility and in no way is construed to be applicable in all situations or other facilities or other settings. Who needs to attend this training? This training was created for the essential caregivers, which in most cases will be a family member. It is also created for the beauty shop operator and also for the viewing of our resident care attendants. What is required of the essential caregiver? You have to test negative within the last 14 days before your first visit. Number 2, you need to meet the criteria for visitation as spelled out in the surveillance questions. And number 3, you have to complete the training for essential caregivers. So what do you do before the visitation? Number 1, you need to present us a COVID-19 testing before your visitation. And COVID-19 testing has to be negative and it has to have been done 14 days before the first visit. Number 2, you need to schedule at least a day before the visit. What it is we need staff to be able to monitor you, and that is the requirement of the Department of Health and Human Services. So we need time to schedule visits and to make sure that no two people come at the same time, because as you all know, we only have 1 or 2 caregivers and we are supposed to be monitoring the visit. Number 3, you have to bring your own protective mask, face shield, or gloves, or if you want a gown, you can do that too. If you're giving a bath, then yes, you can bring a gown. Number 4, you have to review the surveillance questions before you come in. And it's nothing as more frustrating than when you come in here and then only to find out that you cannot be allowed to do the visit. In most cases, if you have a fever, you cannot come in. In most cases, if you have been into an event wherein you were not masked and there was a group of more than 10 people, whether it's indoor or outdoor, we recommend that you don't come in. Number 3, if you were in a travel situation wherein you were traveling by plane, by train, or you traveled outside of Texas or internationally and you had contact with other people on your travel, then we recommend that you do not come in. Now, during the visit, of course, we check your temperature as you come in. We ask you to mask before you even come into the door, and then you answer the surveillance questions. That's why it's good to review them before you come in. Then you go directly to the resident room and you are escorted by the staff. There should be no contact with any other resident or other staff on the hallway or other, visitors when you come in. So we take you directly to the patient's room. You stay in the room and we prefer that you are masked while visiting. As a matter of fact, that's what the recommendation of the Department of Health and Human Services is. Now, in most cases, our residents are able to mask. There may be some residents who cannot mask because of shortness of breath or for whatever reason, and we will let you know that. And that is why we are very um, adamant that you mask, because if a resident doesn't mask, then you also predispose yourself to getting something. Um, the other thing is you are not allowed to loiter in the hallway or to be in the common waiting areas like the living room, the dining room. If you have to use the bathroom, then you can either use the residence bathroom, because we do not allow you to wander in the hallways. Now, again, this is a summary of the essential questions that we ask, and it is best to review it before you come in. So the first question would be, do you have had any symptoms of fever, flu-like symptoms, shortness of breath, runny nose, sore throat, diarrhea, nausea, or absence of taste? Next, have you been in any group who are not part of your household where you or others were not masked and/or social distancing was not observed? Next, have you traveled on the plane, bus, public bus actually, train or cruise outside of Texas or outside of the country within the last 14 days? So if you actually traveled, then you can quarantine yourself for 14 days. And then next, have you tested positive to COVID-19 in the last 14 days? Or has anyone in your household tested positive in the last 14 days? So it's best if someone in the home has tested positive, it is best for you to also get tested and then to quarantine for 14 days before coming in. So the first symptom that you typically will have if you have COVID-19 is fever. So, and by fever, we mean like fever ranging from 99.6, up. You may have flu-like symptoms. It may be like you are tired, you have joint pains, body malaise, aches, and then you have a condition wherein you are not able to taste food, you know. So the reason for that is you can't smell and you can't, so it's the way that the virus sheds itself, it affects you that way. And then you can have a sore throat or a runny nose. And then shortness of breath. Now, people have told me that sometimes those who have had COVID-19, and I've interviewed some of them, is, they feel like they're short of breath, like even just taking a shower, they feel like they're drowning in the shower. So how is this virus transferred, and how does that all translate to what we will be recommending to you when you come in? The virus is transferred between people who are in close contact with one another, and CDC recommendation is that within 6 feet or 2 arm lengths. It spreads through the respiratory droplets or small particles, such as those in aerosols produced when an infected person coughs, sneezes, sings, talks, or breathes. And that's pretty involved, that's about just anything that you do when you open your mouth. Now, in some cases, they postulate that it may also be transferred by contaminated surfaces. When you touch something and then you start touching your hands, or you touch somebody else's face or your face, or you hug or you kiss, then you do have a tendency to transfer the virus that way. Although there is no tests yet or research that has been done to this, this is usually how flu virus is transferred. Now, how severe can be the response? Just like any virus, the response that your body will have depends on two things. One is the virus, and two is you. So these are two competing people in this situation. So the virus can infect you depending on how much of it you get. So like if you is in close contact with someone, then you get more of the virus, so your distance. Number two is the length of your exposure. If you are exposed in a situation for 10 minutes against 10 hours, if you were in the plane, the chances of you getting the virus is greater when you're in a plane in a closed environment. How about your immune system? If you have any pre-existing conditions, if you're undergoing some immunotherapy for cancer or HIV or any other of that sort, then you are more um, uh, likely to suffer from the symptoms of the COVID-19 virus. They have research that's been done that stipulates that a blood type O is least likely to suffer more symptoms. It doesn't mean that you don't catch the virus. They just say that the symptoms are less for people um, who have that blood type. Although research is still ongoing on that, but I wouldn't count on that very much because I wouldn't take that risk, right? And I am blood type O. And then, of course, the presence of antibodies. There has been no known immunity to COVID-19, meaning to say, if you've had it, it doesn't mean that you're immune to it. There has been reinfection cases. So I wouldn't say that, well, I've already been exposed to COVID-19 because my husband had it and I didn't get it, so I probably have antibodies and I probably am immune. That is really kind of like not proven yet, so I wouldn't take that risk either. So what is the repercussion of this to you? That means, these two factors affect how your body will respond to the virus. So what's the timeline of the virus? From the first contact, then it takes about, the incubation period may take 2 to 14 days. For some people, it's faster. Like I've had people that I've interviewed and they've had it that same day, but more typically within 2 to 14 days. And so the significance of that is that's where the 14-day quarantine came from, because some people would develop the symptoms not during the second day, but maybe on the 14th day. And that's the reason why you have to quarantine for 14 days if you've had contact with anybody who has had it, or if you've been traveling, say, in a close airplane, then we recommend that you quarantine for 14 days before coming here to visit. So once you get it, then let's just say you develop it on the 14th day and you have now fever, then you become symptomatic, and you may remain symptomatic up to the 28 days. I've had report wherein after 1 week the symptoms are less, but I've also had situations with some patients who've had it who said that even after 2 weeks after their first symptom comes up, they still, have some symptoms of weakness and inability to eat. So it is very important to remember that timeline because, even if you have the symptoms, say on the 14th day, then that means it may take for you 28 days. On the 28th day, that's the time that you may even be less symptomatic. So what kind of personal protective equipment do you need? Please bring your masks. It can be a surgical mask. It can be a cloth mask. We prefer not to use those bandana-looking things because those kind of drop off from your face, and so it just exposes others to, your breath, and so we prefer that just really a mask that fits tight and that goes out around the ear. We also prefer that you do not bring those masks that have only exhalation valves, and they've been out in the market, and what that does is it only allows you to not breathe others' breath, but it allows you to put out the air that you breathe out. So that still exposes your loved one, if you're in close contact with your loved one, to whatever, you may have. So we prefer for you not to use those one-way valve masks. So a mask should cover your chin, your nose. Again, here it says it should not have an exhalation valve. It should be worn at all times and may be worn with a face shield if you prefer. So we don't require a face shield, but if you're bathing a patient, you might want to do that. It may be worn as soon as you enter. As soon as you enter the facility, we prefer that you mask. So we go to the term called social distancing, and I think I've already mentioned that there is a 6-foot distance that we prefer that you take in consideration when working inside the room. It's really for the protection of both of you. Now, if you have to, touch, shake hands, hugging, it says here no touching, shaking hands, hugging, unless rendering personal care. Make sure you wash your hands and you don't touch your face, because that really could be a problem, as I have discussed earlier. So, putting it into practice, keep your distance 1 meter or 6 feet apart. Stay only as long as 30 minutes inside a room, Again, duration is a big factor. Although research have pointed to the fact that the COVID virus is transferred by aerosol, there has been a lot of talk about whether it is airborne. So, which means to say, in the case of our rooms, then the rooms have its own air conditioner. So what you may be breathing may be recycling, just within the room. We suggest that you keep the door closed while you're visiting. And then again, we limit one person, one essential caregiver per visit. So if there are 2 family members who have been certified to be the essential caregiver of a resident, then you cannot be in the room at the same time. You have to take turns. You have to come on 2 different days, to be honest, because we do not allow 2 essential caregivers in the room at the same time. So plan your visit. Consider essential caregiving surveillance responses. Make sure you check your response to the question so you don't waste your time. Limit 1 caregiver each time, 30 minutes. And by the way, we only allow twice a week. So if there are 2 caregivers, that allows for 1 caregiver to come on one day and another caregiver to come on another day. And then pre-schedule a day before. Limit your location, meaning to say stay only in the patient's room or in the resident's room. And then you need to be masked. The residents, we prefer them to be masked, but if they don't mask, that's why we require you to be masked while in the room. And then only 2 essential caregivers per resident will be allowed on different times. So again, let me repeat myself. So if there are 2 essential caregivers or 2 family members who wants to be certified as essential caregivers, then one has to take 1 day and the other one has to take another day for the week. So what happens then if you cannot answer the surveillance questions with a no? So which means maybe there are days that you have been to a wedding and then you were not masked, so actually you cannot come in. So what do we recommend? Well, we recommend that you do other types of visit, like in this case through the window visit, or another option is outside visitation. Outside visitation, there's more structure, so you remain seated, and then so and then you're both masked, and of course it's an outside visitation, so you're not breathing the same air, so they said it's a little safer. So if you're not able to meet the criteria, or other visitors who want to visit, then we recommend just a through the glass visit and outdoor visitation. So what do you do after the visit? Well, you remove all your mask, your gloves. Next, you wash your hands with soap and water. And then if you would push the call light, because the Department of Health and Human Services requires that we escort you out of the building. So please push the call light when you're ready to leave. We also need to document the time you all left, so if you can do that. And then when you get home, do your own self-monitoring of your temperature. It doesn't take a lot. Just take your temperature every day, just to, kind of know where you're at to, so that if something does develop, then please give us a call. If you develop any signs and symptoms of COVID-19, just contact us immediately. And if you have if you have had any contact with someone who has had COVID-19, we just recommend quarantining yourself and refraining from visiting. Now, your aftercare at home is just as important as your visit, your in-house care visitation. So please do what we suggest that you do when you get home. It is very important. So lastly, if you have any questions, please give us a call. Our goal is to provide a safe place for your loved one. Our goal is to also make our residents, happier. We know that it's been a hard 7 or 8 months now, and that's why we're trying to do this. It is not easy, but we know that we can get it done when we stick together, just like the Simpson family. When we stick together, we can do anything. So we can get past this COVID-19. We wish you well, and if you have any questions, just give me a call. This is Victoria. Thank you so much for taking the time to be certified for caregiving.